just an asymmetry without any further details. But let's go and see what is the correct answer. Unfortunately, the correct answer is D. So let's go back again and see what did we miss. This is the ultrasound of the same case. You can see here it's a mixed solid with cystic component, and this solid component has some high vascularity, and with the elastography it's more toward being hard. So this is the ultrasound picture. And this is the CC of our case. So where is the tumor? It's in the ear. But is there any indirect signs for that? Draw a line, see the tenting of the parenchyma, as you can see in here. So this was the first case. So before I go into the second case, so what do we learn from here is that look at the indirect signs, especially when you have dense breast. This is, of course, the nightmare of every radiologist practicing screening. But just with MAG, do magnification, look for the subtle indirect signs of architectural distortion. Okay, second case again, but she has lumpy breasts, both sides. And in order just to see, again on the same basis like the first one, she has a cancer. So it's either A, B, C, and D, and I will leave this to you to vote for it, and you can start voting now. These are real examples of everyday practice. So what we have here? Well, okay, 2 for number B is 39 almost percent. And then we have number D, 25%. Okay, the answer is B. Let's go to the case back again and see why it's B. But we had a clever radiologist who did this case, and that's how exquisite is the contrast spectral mammography. Just wow, you don't need any skills. It's just a tumor that is saying, hi, I'm there. So it's not a big deal there. So this is the second case. So contrast enhanced mammography, of course, lots of presentations we heard this morning about the value and the usefulness and the sensitivity, etc., of the spectral mammography. And I don't want to go into more after what you heard. And this is the MLO of the same cancer. Okay, now we go to cases. Now, a 54 years old lady with bilateral breast lumps. She feels lumpy breasts. It's very classic and very traditional for everyday practice. But to make it easier, present the right breast, because it's one of the concerns, just to make it easier. This is the CC, MLO, CC, and the tomo view of the pathology. So, and this is the ultrasound, again, of the pathology. And you can see here the ultrasound is really a composite mixture of maybe cystic and maybe solid areas or non-homogeneous area, whatever you call it. And it has a resistive index of vascularity 0.64. And this is the MRI. As you can see, we have axial T1 and axial T2 inversion recovery and the sagittal T2 of the lesion. So, concentrate. Okay. This is the subtraction. So, what's your BIRADS? Is it 2, 3, 4, or 5? So start voting now. Most of you voted for BIRADS 4, it's 54% actually, and then BIRADS 5, so this makes it more than even almost 90%. So this is malignant for all of you. Good work. Okay. So, and the diagnosis, would that be invasive duct carcinoma, papillomatosis, fibroadenosis, or invasive lobular carcinoma? And you can vote now. Okay, 61.5% for invasive carcinoma, and yes, actually this was the right answer. I think this was quite easy for most of you here, and it has some of the classic features by MRI. Okay. Case D. This is left breast lump that was of duration of 1.5 years ago. And 1 week ago, she felt redness and swelling of the entire of the left breast. She took antibiotics, and just to know, she is lactating, or recently have been lactating. This is the axial T1 and inversion recovery of the breast. Look carefully. And this is the subtraction image and the MIP image. So, just to recall what you have learned this morning, was this a non-mass enhancement, or an enhancing mass, or a focal asymmetry, or a normal lactating breast? Start voting now. Oh, wow. 72.5 left non-mass enhancement. And the rest is okay, normal lactating. And why is there asymmetry of both sides, just for the sake of arguments? Anyhow, yes, for sure it was a non-mass enhancement. And then, what's the diagnosis? Lactating mastitis, invasive duct carcinoma, fibrocystic disease of galactosele. Please start voting now. Okay, one, lactating mastitis, almost 85%. Okay. Are you sure about that? Yes, you are all right. Very clever of you. Good. So this is another case which is very heterogeneous breast, and she's coming for a lower outer quadrant left breast lump. And this was her mammogram. So we are dealing with left breast lump and the lower outer quadrant. Can you see anything? I can't, but maybe, who knows. So this is the mammogram. So definitely the second step is just to do an ultrasound, and this was the ultrasound picture. There are two pictures here, one showing small mass, the other at the bottom. You say, what does it show? And this is the MRI. We have the axial T1, the sagittal T2, and the axial inversion recovery. Okay, all ready? So, one more to make it easier. So this is the axial lip and the subtracted images. Look carefully. Look for the shape, for the pattern, and then your findings. So we have a multifocal mass or clustered ring enhancement or enhancing cysts. What we were dealing with. We started earlier, and ابتديت قبل ما أنا أقول. Okay, vote now. I think I'm dealing with experts here. Okay, yes, you were right. So most of you voted for the clustered ring enhancement, which in reality is the case. And yes, this is true. And I want to go back and for those who didn't see that. It's quite obvious, especially in the bottom two images and the one up on the right side. It's clustered ring enhancement. So, you described it correctly, but how would you interpret? Is it mastitis, invasive duct carcinoma, or a fibrocystic disease? Please start vote now. Interpretation is very important to reach the diagnosis. If you don't see the signs, you will fail to interpret correctly. Okay. Invasive duct carcinoma, 59%. Fibrocystic disease. Okay, the majority did quite well in the invasive duct carcinoma. Cysts, usually they don't enhance in that manner. If there would be an enhancement, it would be a thin, very thin rim, not just very thick and clustered in a sense. Okay. This is a 39-year-old woman with right breast, probably an abscess on clinical basis. She's been operated upon before, but unfortunately we had no cytology or pathology. By the way, she's not Egyptian. She was coming from elsewhere. No, I don't recall. And just for a change, start with the ultrasound, very heterogeneous structure, I would say, and maybe slight increased vascularity there at the bottom with some complexity of the lesion. MRI, look. As you can see here, we have the T1 and T2 and the inversion recovery, the usual. And as you can see, it's almost involving the entire right breast, or most of it. And this is the subtraction. Look at the center and some of the subtracted images and the mid image. I'm sure some of you have clinched the diagnosis, but don't be that confident. So, what's your diagnosis? Is it an invasive duct carcinoma, fibrocystic disease, granulomatous mastitis, or, don't forget, she's done an operation before, a post-operative sequelae? Please start quoting now. I'm sure you are all experts. That's very good. Good of you. Just a piece of information that I knew about this case, believe it or not, but this is the case. This lady tried to augment her breast, and I wouldn't say it's a physician who did that. They inject the breast with oil, with honey. Inject the breast with honey. Yeah, and maybe that's the cause of the previous abscess that she suffered from. And but anyhow, this was غني. عشان الحالة حلوة معسلة كويس. Anyhow, yes, this was a granulomatous mastitis, and thank you very much. You did a wonderful job.